Hi, hello dears, welcome back to a new video. Okay, so today's in pharmacology lecture 2. Okay, so that's the section 2. There we are going to discuss the drugs used in congestive heart failure. Congestive heart failure, in short, we will represent it by CHF. That is what? Congestive heart failure. So how we can define the congestive heart failure, that is CHF. This is a clinical condition in which heart is unable to pump sufficient blood to the body to meet our metabolic needs. Okay, so we can tell in this condition of CHF, our heart become weak. What? Our heart become weak, thereby pumping will be difficult. Okay, so to improve that, we will use the congestive heart failure drugs. Okay, so the main features of the CHF is it will reduce the cardiac output and fluid retention will be there, increases the venous pressure, and we will feel like pulmonary edema and peripheral edema. Okay, so what is the goal? Why we are using this treatment? What it will give? It will improve the cardiac output as well as it will reduce the symptoms like edema and dyspnea. Okay, and it will prevent the progression and it will improve the surveillance of the patients. Okay, now you are clear about it. What? Why? Where we will use the CHF? When our heart is weak. Okay, when our heart is pumping the blood in the weak, pumping of the will be unable to pump. In that cases, we are going to use the CHF drugs. Okay, so here the classification of drugs in CHF is very important. Okay, so we have 7 types. The first one is positive ionotropes. What is positive ionotropes? We can give the example of digoxin, dobutamine. Okay, which will increases the contractility. Second one is the diuretics, furosemide and spironolactone is an example, which will decreases the fluid overload. Third one is ACE inhibitor. Example is enalapril, ramipril. Okay, which will decreases the afterload and remodeling. Next comes to the fourth one, angiotensin receptor blockers will represented by ARBS. Example is losartan, valsartan. Okay, this is the alternative for your ACE inhibitors. That means it will decreases the afterload and remodeling. Next comes to the fifth one is the beta blockers, that is carvedilol and metoprolol, which will decreases the sympathetic stress. And sixth one is the vasodilators, which are example is hydralazine and nitrates. Okay, which will decreases the preload as well as afterload. Then some new drugs. The seventh category is the new drugs, that is sacubitril and ivabradine. So this new drugs is for the modern heart failure therapy. So we have how many classification? In the classification we have to 7. Okay, the example, then this is the what action it will give. This is the action. Okay, so this is very important, the classification of drugs used in CHF. Okay, so in today's class we are going to see about positive ionotropes. In one lecture we will see the one classification. Okay, let's see about positive inotropic drugs. Okay, that's the first classification. So in this case you have to remember increases the contractility. I hope you people know the contractility means what, which will increases the contraction of the muscles. Okay, so muscles should get contracted, then only pumping will take place, right? So here it will increases the contractility. What positive inotropics will do? Which will increases the contractility. So we know when we have the CHF, our heart will be weak. If our heart will weak means body will pump the blood in sufficiently, right? Sufficient quantity of blood, it won't reach into the body parts. So nutrient supply, oxygen, so everything will affect. So what is positive inotropic drugs? Which will increases the force of myocardial contraction. So it will increases the force of cardiac contraction. We can tell the drugs which will increases the force of myocardial contraction by improving the cardiac output. Okay. So what are the main indications of by using the positive inotropics drugs? First one is the acute heart failure, then severe systolic CHF, okay, then cardiogenic shock. These are the main indications of your positive inotropic drugs. Okay, so the main points you have to remember here is, if you are increasing the contractility, we will get the increasing cardiac output. If the cardiac output increases, means we can tell we got symptom relief from your CHF. Okay, so basically you can remember like this, it will be easy. Okay, CHF is a condition where your cardiac output is decreases, right? Decreases in cardiac output. So if the cardiac output is decreased, means what will happen? We'll get poor organ perfusion. That means your blood won't get supplied into the body part how much is required, right? Sufficient quantity it won't reach, and we will feel a congestion, right? Then that will leads to the need to increase the contractility. So we will use the positive inotropic drugs. Okay, so the drugs mainly used in acute or severe CHF, not in the mild cases. So where we will use the positive inotropic drugs? Yeah, mainly in the acute as well as severe CHF, not in the mild cases. So I hope you people understood what CHF. CHF is the condition in which we have the low level of cardiac output. That means cardiac output will decreases. That will leads to poor organ perfusion plus congestion. That will we in that condition we require to increase the contractility of the heart muscles. So it will lead to positive inotropic drugs. Now let's discuss the classification of positive inotropic drugs. It is subclassified into 4 types. The first one is the cardiac glycosides. You can give the example of digoxin. Okay, so the mechanism of this digoxin is it will inhibit the potassium as well as sodium plus potassium ATPase inhibition. Okay, the second one is the beta adrenergic agonistus. The example you can give dobutamine and dopamine. So the mechanism is it will stimulate the beta stimulation, which will increases the CMP. And the third one is the PDE3 inhibitors. The example is milrinone and amrinone. Okay, so which will prevent the breakdown of your CMP. The fourth one is the new category, that is what? Calcium sensitizers. So levosimendan as an example. So it will increases the troponin sensitivity. Okay, so what is this positive inotropic drugs? Which will increase the force of myocardial contractions. So we'll get the improvement in your cardiac output. So how it will work? CHF means decreasing the cardiac output. So it will lead to poor organ perfusion plus the congestion. So we require to increase contractility. So we will use the positive inotropic. So positive inotropic drugs is classified into 4 types. Now we will see about the cardiac glycosides. Let's discuss about the cardiac glycosides. So we say the example is digoxin. Digoxin is a classical drug for your CHF. Okay, so as I said previously, this digoxin we will give in oral form. Okay, the oral form we will give digoxin oral form. Keep it in mind. The main part of this is the mechanism, how it will works on the body. So Digoxin, which will inhibit the sodium as well as potassium ATPase. Okay, which will leads to increases the sodium cell, so increases the sodium level inside your cell. Okay, once if the sodium level here increases, right? So next case we have sodium plus calcium exchanges pump. Okay, so in that cases the sodium plus calcium exchanges will slow down because the presence of sodium inside the cell. Okay, so your calcium will get trapped inside, so the calcium cannot go out, so the calcium increases the inside the cell. So if the calcium increases inside the cell, will get the strong contraction of heart, which will improve the CHF. This is how it will work. Okay, first thing, which digoxin is going to block the Na plus and K plus ATPase. Then Na plus inside cell will increases. So Na plus and K and calcium exchanges will slow down. So the calcium cannot go out. So the calcium increases the inside the cell. So we'll get the strong contraction of heart, which will improve the CHF. So you have to remember, like, it's having the severe steps. The first step is the digoxin blocks the Na plus and K plus ATPase. Normally your heart cells have a pump that we will call it as Na plus or Na sodium plus potassium ATPase pump. Okay, so there the role is your sodium. Okay, sodium will goes out and your potassium will come inside. Okay, so what your digoxin is going to do, which will inhibit the sodium as well as potassium ATPase. So sodium cannot go out. So sodium start increasing inside your cell. Okay, so you can remember, like, digoxin increases the sodium inside the cell. Next comes to the step number 2, that is sodium plus calcium exchanges will get disturbed. How? There is another transporter. Okay, the first transporter is sodium as well as potassium. The second second is sodium plus calcium. In that case, the normal function is your sodiums will brings in and your calcium will push out. Okay, so in that case, sodium is already high inside, right? So the exchanges cannot work properly. So calcium cannot go out. So the your calcium will increases. Okay, thereby your contraction of heart will be more. That means more calcium stored in your sarcoplasmic reticulum, where sarcoplasmic reticulum, that is we will call it as storage house. Okay, so during next heartbeat your more calcium ions will get released. Okay, so more calcium ions means you have to remember some strong contraction of the heart. Okay, that is due to the stronger binding with the troponin. Okay, stronger binding of calcium ions to the troponin will lead to the stronger contraction. So increases the calcium plus, which will increase the force of contraction. So I hope you people understood. So in tricky, you can remember, like, your sodium pump, okay, is a door which is existing. So your digoxin, what it will do, it is going to close the door. So sodium stays inside and your calciums, another transporter, calcium plus sodium, right? So your calcium is also getting trapped over there. So if we can remember, if more amount of calcium is there, it will get more contraction of your heart vessel. We are talking about the adverse effect. Adverse effect means what? The side effects. Normally the digoxin is a is having the narrow therapeutic index. So it will show the side effects like arrhythmias and nausea, vomiting and yellow vision. Okay, comes to the dose. We will give the 0.125 to 0.25 mg per day. What is 0.125 to 0.25 mg per day? So the contraindications are hypokaleminemia and ventricular tachycardia, AV block as well as WPW syndrome. Okay, so this will come for 5 marks as well as 10 marks category. It is very important, digoxin. Okay, I hope you people understood.